Okay. Good afternoon. This is Assembly Budget Subcommittee 1, and we're about to get started. Assemblywoman Chair of this subcommittee, Weber, was unable to attend today, so I will be chairing today's session. We will begin with the California Department of Aging, and I will ask the panel to come on up. Laura Connolly, Director of the Department of Aging, Ed Long, Deputy Director, LAO, Department of Finance. And we will begin with the department making a presentation. Good morning. Good afternoon.
Good afternoon, committee members. Laura Connolly, Director of the California Department of Aging.
And Ed Long, Deputy Director of the Long-Term Care Division at the department.
And you should have before you two handouts, one that's an overview of the department and one in smaller type that goes through, it's an overview of our various department grants. So hopefully you have both of those.
Not quite yet, I don't think, but I think they're about to distribute them to us.
Great.
So,
let me go ahead.
Go ahead and start.
Okay. Let me go ahead and begin, and I'm going to be working from the overview and just kind of walking through that. Just to start, in terms of our department, the mission of the California Department of Aging is to promote the independence and well-being of older adults, adults with disabilities, and families through access to information and services, opportunities for community involvement, support for family members who are providing care, and collaboration with other state and local agencies. The CDA is the federally designated state unit on aging, and in that respect, we administer funds allocated through the Federal Older Americans Act, the Older Californians Act, and through the Medi-Cal program. The department contracts with an array of a statewide network of 33 area agencies on aging who directly manage a wide array of federal and state-funded services that help older adults find employment, support older and disabled individuals to live as independently as possible in the community, assist family members in their important role, and advocate on behalf of residents in long-term care facilities. Each area agency on aging is responsible for service delivery in one of the 33 planning and service areas. These are geographic areas throughout the state, and they may include one or more counties. And on the back of your handout is the map that actually breaks out where those area agencies are in the planning and service areas. The Department of Aging also contracts directly with agencies that operate the Multi-Purpose Senior Services Program, MSSP, through the Medi-Cal Home and Community-Based Waiver for the Elderly, and we certify adult day health care centers for the Community-Based Adult Services, commonly known as the CBAS program. And I will just briefly walk you through the major programs that the department administers through these various acts. Probably the one that's most familiar to you, and you may even have visited some of these programs, is the Senior Nutrition Program. This program provides meals at congregate nutrition sites or home-delivered meals to individuals who are age 60 and over, and to have a need for that important program. Secondly are the supportive services program that are also delivered through the Older Americans Act. These services provide assistance to older individuals to help them live as independently as possible and to access services that are available to them. Among the services under the supportive services Title 3B program include information assistance, transportation services, funding to senior centers, in-home and case management services, as well as legal services for frail older adults. I would note particularly the senior legal services component, because that's going to be one of the BCPs that will come up later in the presentation. Senior legal services is one of the supportive services funded under the Older Americans Act, and it's a priority service, which means that each area agency on aging must include it as one of their funded programs. There are 39 legal services projects that assist that assess legal service needs and assist older adults and adults with disabilities in their community with a variety of legal problems. And we'll talk about our grant coming up further on. The Family Caregiver Support Program is another one of the Older Americans Act programs that provides supports to unpaid family caregivers of older adults and grandparents or other older relatives who are the primary caregivers for grandchildren. The Long-Term Care Ombudsman and Elder Abuse Prevention Program. And then in terms of our non-Older Americans Act programs is the Health Insurance Counseling and Advocacy Program, HICAP, which provides personalized counseling and outreach to Medicare beneficiaries on their health and long-term care coverage options. The Senior Community Employment Program, which is funded through the Department of Labor currently, but is actually both HICAP are they both transitioning at the federal level? Not quite sure about senior. About the senior.
V,
yep. Yeah. But the HICAP program is transferring from CMS to the Administration for Community Living during this current year. And then the Multipurpose Senior Services Program, MSSP, is one of our Medi-Cal programs, which provides health and social case management to prevent premature and unnecessary long-term care institutionalization for older individuals who are nursing home certifiable. The cost of services in this program must be lower than the costs related to residing in a skilled nursing facility. And this program operates under an 1115C home and community-based waiver, and the department contracts directly with agencies that operate the MSSP program. And then the Community-Based Adult Services Program, CBAS, is another Medi-Cal program that provides community-based day health care programs that support older adults with chronic medical, cognitive, or mental health conditions or disabilities that are at risk of needing institutional care. Effective April 2012, this program, which had previously been under the Adult Day Health Care Program, began under California's Bridge to Reform 1115 Medicaid waiver. And per an interagency agreement with the Department of Health Care Services, Department of Aging is responsible for certifying the CBAS centers, the CBAS sites, which are also licensed by the Department of Public Health as adult day health care centers. So we use the name interchangeably for Medi-Cal participation. And both MSSP and CBAS programs are administered by CDA via an interagency agreement with the Department of Health Care Services. The governor's proposed budget for fiscal year 2014-15 for the Department of Aging is $197.5 million, and $32.2 million of that is from general fund. And I'm at this point on page 4 of the handout. The table below there breaks out the funding source for each of those years over the past 5 years by the various reimbursement areas in terms of federal general fund reimbursements and other funds. And I know one of the areas of interest and concern is the previous funding reductions that have occurred over the last number of years in terms of our Older Californians Act programs, and we have provided details in terms of that on page 5. Between fiscal years 2007-8 and 2011-12, the Department of Aging budget was reduced by approximately $30.1 million in general fund. This included the elimination of the state funding for the community-based services, the supportive services, long-term care ombudsman, and elder abuse prevention, as well as the senior community employment, and a reduction in terms of the MSSP funding. And the table that follows below there actually itemizes those reductions in the years that they were taken in that time period, totaling up to the $30.1 million in reductions. As I mentioned, the community-based services programs were general fund was completely eliminated for these programs at the end of fiscal year 2009 and 10. The programs still continue to exist in law in the Older Californians Act, but remain unfunded. And the one thing that I would note is the foster grandparent program, which is not shown in the table that follows below, was also eliminated in prior earlier budget reductions. So this table itemizes what those reductions were and how they were taken over those years leading up to 2010 and 11. The Long-Term Care Ombudsman Program General Fund was also eliminated in the 2009-2010 budget reductions, and that was all of the general fund support that was had previously been allocated to the Long-Term Care Ombudsman Program, which totaled $3.8 million. And I'm going to kind of, in the next section, talk a little bit more about the offsets in terms of the Ombudsman funding and then impacts related to sequestration to kind of bring you to today. In terms of the department's federal funding, when you kind of look at that bar chart there over the last 6 years, there have been very small changes in terms of the overall funding at that level. Slight increases that was primarily related to increased ARA funding for a short period of time, primarily related to increased nutrition funds in 08, 09, and 9, 10, and then the ending of that ARA funding. The Ombudsman Program, given the $3.8 million in general fund that had been lost for that program, we have moved forward, through action of the legislature to backfill some of the funds that were lost for that program. So between fiscal year 2009 and 2010 and 11 and 12, there were several one-time appropriations and funding solutions used to partially backfill the lost federal citation penalty account monies and the lost general fund. In 2012 and 13, through the sequestration reductions that we just took at the federal level, ombudsman funding was reduced by about $0.2 million through the sequestration actions. And currently the program's total funding, including those coming from the federal state citation penalties account and the skilled nursing facility quality and accountability funds, is $5.6 million. Compared to the $7.8 million prior to the reductions. We've also outlined here in this section under the federal funding some of the additional funds that we've received in recent years. The ARA funds, as I mentioned, the Medicare Patient and Provider Act funding increases that we've received, as well as the senior community employment increases related to the ARA time period as well. Most recently, the impacts have taken a negative toll at the federal level, and that is related to the sequestration reductions. In fiscal year 2013 and 14, CDA lost $9.8 million in federal funding overall due to the implementation of the sequestration reductions. However, for fiscal year 2014, we've been notified by our federal funders that the senior nutrition program will be restored and protected to the 2012 levels, which was the prior sequestration level. And the table at the back of this section on page 9 provides a breakout detail of all the Older Americans Act programs and the sequestration reductions for those programs to give you that level of detail. We have other special funds that have been coming into the department, and that's the second handout that we have prepared for committee members. That's the small print one that I mentioned. Very small. I have my
glasses on.
Very small print. I know, difficult. And we'd just like to call out, we have some special, what we refer to as special grants. Those are primarily demonstration grants that we need to apply for and compete for. And then following that, in the handout are our ongoing regular federal grants that we receive from the Administration on Aging or other federal funders. And there are two that we've been asked to call out in the agenda. And Ed, you want to speak to the transportation
Sure.
grant?
Sure. So we received a 2-year federal New Freedom Transportation grant through Caltrans from the Federal Transportation Agency to assist area agencies on aging and independent living centers to increase their knowledge base and capacity to engage in transportation planning, mobility management activities, and the delivery of transportation services to older adults and people with disabilities. So we were, through this grant, able to hire a New Freedom Transportation Specialist, a Health Program Specialist 1, who was knowledgeable in transportation issues. As you're aware, when you look at human services versus transportation, you may be speaking about different time frames, different types of approaches to planning, different languages in terms of what you need to do to impact planning. So our specialist job was to assist. The focus was really on skill development, understanding the transportation environment, and the funding streams and how they worked, and how to engage successfully in the transportation processes locally. So that was the purpose of the grant. We developed, we received an extension on our grant from Caltrans because we started late. It took us a while to find a person with the appropriate skill set. So our activities have been extended through the end of April, although our position authority for our specialist ended in October. So we've really been focusing more on closing out the grant and working closely with the transportation work group at the Olmsted Committee to identify some issues that might be taken forward to address some policy issues at the state level.
Okay. And the second grant that was mentioned in the agenda is the Chronic Disease Self-Management Grant. This is an effort that we've actually had on an ongoing basis through a number of grants from the Administration on Aging since 2006. This is an evidence-based program, a workshop, a 6-week workshop that individuals are involved in who have chronic health conditions, and it really focuses on helping those individuals implement those very difficult behavioral changes that make all the difference in managing a chronic health condition, whether that's heart disease, diabetes, arthritis, a number of different chronic conditions. The program was developed at Stanford University and is at this point used internationally. In our previous grant, we have had over 9,000 older adults go through the program, and in our current grant, another 9,000 is our performance measure in terms of meeting that goal. The grant ends in 2015, and we think we're well on our way in terms of meeting that goal. We do this grant in partnership with the Department of Public Health, both at the state level and at the local level through our area agencies on aging and a number of partners in the healthcare field, community services field, in terms of identifying and bringing people, older adults and adults of all ages with chronic conditions into these grants. Our specific partners in this grant are the counties of Los Angeles, Orange, Napa, San Diego, San Francisco, Solano, and Sonoma. They're under our particular grant, but as I said, we coordinate very closely with Department of Public Health that actually works with the public health departments in a number of other counties in terms of implementation, so the reach is actually broader than that. And I think those are the particular grants that we were asked to kind of call out in our overview here. I've spoken just in general terms, in terms of the CBAS program and the transitions that have occurred in that program over the last several years. And I think the MSSP transition into managed care through the Coordinated Care Initiative is the other area, and Ed's going to address that.
So as you're aware, we're working closely with the Department of Health Care Services on issues related to the transition into managed care of MSSP participants in the 8 demonstration counties for the Coordinated Care Initiative. Under the CalMedi Connect component of CCI, delivery of medical, behavioral health, and long-term supports and services is coordinated through a single managed care health plan for persons eligible for both Medicare and Medi-Cal, including long-term services and supports, and long-term or supports and services, and as defined, those include CBAS, MSSP, IHSS, and skilled nursing. This also is occurring for people who are only receiving their Medi-Cal benefits through managed care plans in the CCI counties, either because they will opt out on the Medicare side and not choose to enroll into CalMedi Connect, but in order to receive MSSP, CBAS, IHSS, and skilled nursing care in the demonstration counties, people will be required to be enrolled in a Medi-Cal managed care plan with certain exceptions. So I believe in your agenda you've printed a chart that you received from the Department of Health Care Services that was updated recently that speaks to how the cutover into managed care will be accomplished for both CalMedi Connect and what they identify as managed long-term supports and services. After cutover into managed care, MSSP sites will continue to contract with managed care plans to deliver MSSP waiver services for 19 months. After that time, it is anticipated that in the demonstration counties, MSSP is a distinct waiver service for managed care enrollees. Does not continue, but those care management responsibilities are absorbed into the plan. And there will be certain instances in the CCI counties where people may not be enrolled in the managed care plan, either because they aren't eligible for managed care or they're in a county that a managed care plan doesn't serve. So there may need to be some waiver capacity still in fee-for-service for those individuals, but those would be very few individuals. We've also provided, and I think it's also in your agenda, a listing of the MSSP slots that are funded for both the Coordinated Care Initiative counties and the non-Coordinated Care Initiative counties. And as I know you understand, slots are like chairs in a classroom. People can move in and out of them, so the actual number of participants served through these slots can be higher than the number of slots indicated. And so this is what we're anticipating will be the number of funded slots for MSSP through the waiver in fiscal year 2014-15.
So by the way, just a little editing over the microphone. I don't see Del Norte on there. So always looking out for my counties, you know.
I think our...
Is it maybe folded in with Humboldt?
Yes.
Okay.
Yeah. And we'll...
Because it's the Area 1 agency, it's the 2 counties.
Yeah. Sorry about that.
That's all right. I just want to make sure you didn't forget about it.
We'll call out for Del Norte, and we'll make sure we make the change.
Okay.
Thank you. So...
So there's been a change in the dates of implementation, I understand, and that's just recently been announced. And
yes.
Can you update us on that?
Well, I know that DHCS has announced that there will be a stakeholder call next week to talk about some of the changes in implementation and enrollment. In terms of an update,
You're not sure what I'm asking for?
Yes,
July to August, I think.
yeah.
is what-
Well, follow up with staff, and staff will have a
Okay.
conversation with them about that. I'd appreciate it. With regards to the stakeholder process, is that going to be ongoing? Because we're as members, in receipt, not so much, none of my counties are in, but the legislature in general have had input from, and undoubtedly when we open it up to public testimony, we're going to hear some of that about longer-term concern about implementation and making sure that there's not a loss of adequate care for these folks as a result of the transition.
Right.
And I'm just curious if that stakeholder process is going to be ongoing so that there's an opportunity for feedback about, obviously there was once a year before this committee, but for the stakeholders themselves to continue to have an opportunity to critique and give feedback as to how it's
My
going.
understanding is that the stakeholder process at the local level certainly continues through the implementation of the CCI demonstration. And I can say from the Department of Aging standpoint, we have ongoing communication both with the MSSP sites and the MSSP Site Association. We also are in dialogue or trialogue, you might say, the Department of Aging, DHCS, and MSSP sites and MSA. So I would anticipate that that discussion will continue.
And that was try, not trial. Just
I understood. You got it. Okay, well, does that complete the department's presentation?
this section, yes.
Okay, well, next I'm going to call on the Legislative Analyst's Office.
Good afternoon, Mr. Chair, members of the committee. My name is Rashi Kesarwani with the Legislative Analyst's Office. There were several reinvestment proposals that were outlined in the agenda for both aging programs and for the multipurpose senior services program, and I'd like to highlight a few points related to those proposals. First, our office has recommended a strategic approach to allocating the projected budget surplus in 2014-15. In addition to building a strong reserve and paying off budgetary liabilities, we also find that inflationary increases to maintain existing programs, as well as new commitments for program restorations, could be an appropriate use of the expected budget surplus. The decision to make restorations to the aging programs or the multipurpose senior services program or both would depend upon competing legislative priorities. The legislature would want to balance such program restorations with the goals of building a strong reserve and paying off budgetary liabilities. Second, it's our understanding that the department is currently in the process of conducting a survey to assess the impact of budget reductions on the programs and services provided by the local area agencies on aging. And the results of this survey could potentially provide valuable information on whether program restorations are appropriate, and if so, what level makes sense. Finally, it's also our understanding that the California Association of Area Agencies on Aging has suggested a block grant approach to provide restored funds to the local area agencies on aging. In the past, our office has been supportive of a local block grant for aging programs. This approach would give area agencies on aging flexibility to allocate any restored funds based on greatest need. Thank you.
Thank you very much. Next, I'm going to call on Finance.
Yes, Mr. Chair, members of the committee, Corey Nitschke, Department of Finance. This proposal wasn't included in the administration's plan. The current budget surplus is modest at best.
When you say this proposal, you mean the reinvestment?
I'm talking about the reinvestment proposal. Okay. My apologies. The reinvestment proposal was not included in the administration's plan. The budget surplus is a very modest surplus, and due to the volatility of the capital gains income, we still have to be vigilant of our commitment of public funds.
Okay, thank you very much. And at this point, I'm going to open it up to public comment. And so those of you who've been around for a while may remember that I've been known to be quite a bit more liberal with time than the preceding chair and the current chair of this. But in respect to the actual chair of this committee, I'm going to try to be a little tougher than my reputation. So I'll give each of you 2 minutes and encourage you to try to stick to that timeline, please.
I'll try. Mr. Chair, members, Darrell Kelch with the California Association of Area Agencies on Aging. We are requesting the restoration of $16.6 million. As the department demonstrated in the material that they gave to you, when there was the financial deficits of the state, the aging programs were, cut drastically to the point where they were just totally eliminated. Programs closed, services were denied. Many older people were unable to get services. We have not done a study of what happened to these clients. We didn't have the funds to do that. It's nice to hear, although it was a surprise for me to hear, that the department is doing a study on the impact of the cut. Hopefully they'll talk with the area agencies about that. There's going to be a lot to testify in terms of different services and the need for those services, but I would like to indicate, I know the department talked about the Coordinated Care Initiative, the CCI. It seems ironic at the time that we are trying to implement the CCI, which is going to be a program that's going to have to rely heavily on community services to keep people independent, keep people home. We won't have the services out there to help do that. And so there's somewhat of a conflict here as we try to move forward with the CCI. So appreciate it.
Thank you very much for your testimony. Next witness.
Next short witness.
We have a flexible microphone.
Not that flexible. Keeps going back up. Okay, hi. I'm Debbie Toth. I'm the CEO of Rehabilitation Services of Northern California. And I kind of don't know where to start just because so many things have been mentioned. And we have adult day health care and MSSP, and we had an Alzheimer's daycare resource center that was funded. Now it's not. We still provide it. And we're a little bit all over the map, and I didn't expect the CCI discussion today. So we'd love the opportunity, and I'm here on behalf of MSA today, our Multipurpose Senior Services Site Association, so MSSP. And we'd like the opportunity to express some more concerns offline about the implementation and the rollout and some of the concerns we have about the population. So I will not focus on that.
We would welcome that further input.
Outstanding. Thank you. So I wanted to talk just briefly about the senior safety net. As you heard, there has been a huge erosion of the senior safety net, and I know that you know this and have been a huge supporter. But I want to say if finance is looking at not putting any money there, I would encourage you to listen to the LAO. And if finance is looking at some portion of funding of the programs and not a full restoration, which I'd love to see. Let me put that out there. I'd love to see a full restoration of everything. But if there is limited amount that we can restore, then I would look at what the existing infrastructure is and the acuity of the people needing the services. So MSSP serves people who are level of care of skilled nursing. So their other alternative is they're going to be in a skilled nursing facility. We have the slots available. Ed Long did a beautiful job of describing to you an empty school seat. So we have these empty seats, and we'd be able to serve them if you funded them because those slots exist. And I think that that's important because we're being pressured by Department of Healthcare Services to increase the number of transitions we're doing out of skilled nursing back into community living, and I can't do that if I don't have funded slots in our multipurpose senior services program. And I'm happy to answer any questions you have, spend some more time with you. We happen to have a pretty global look at what's going on because of the vast programs that we provide. And thank you very much for this opportunity.
Thank you very much. Next witness.